So we have 1 hour and 15 minutes, and let me tell you, I will not take it personally if you have to leave, if you decide this is not for you. You know, I'm a compassionate person. I will have compassion for myself and for you. So CBCT, cognitively based compassion training, I'm honored. It's with great privilege and enthusiasm that I bring this conversation to you today. I hope, although I will do most of the talk, I hope it turns into a conversation. I actually want to talk about the clinical applications of these mindfulness and compassion meditation protocol with the clinical population that I work. I work mostly with children with autism spectrum disorders or disorder, I should say, according to the last DSM-5, and their families. And I was fascinated by the invitation to come here and talk in this conference about rehabilitation medicine, about the potential of this mindfulness and compassion protocol to rehabilitate people. So I am affiliated with Emory University. I also hold an assistant professor position. I'm a clinical psychologist there. I'm all that. I'm also from Spain with a long last name, Fernandez-Carriba, blah, 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 blah. And first and foremost, I am a human being. I am a man. I am my own self, my own circumstances, together with the work that I do. Yes, I'm a cancer survivor twice, and I will bring that in. It's part of my personal story that I think it's important to share, because what we do is not away from who we are. And I'll elaborate on that as we go, but bear with me. I had to include this slide, no disclosures, no financial interest. I've done this work with the salary that I get paid for being a clinical psychologist. No external funding so far, but very excited about getting it. And the objectives, I would like to start with number 2. We are going to discuss the association between compassion and resiliency, between compassion and well-being and health and restoring health. Then we'll go to number 1. We'll describe the methods and techniques involved in the practice of cognitively based compassion training. And number 3, last but not least, I'll discuss the importance of applying and utilizing CBCT, that's the acronym, in clinical practice to positively impact physical and mental well-being. This is why we are at this conference, right? Let's start by the definition of resilience or resiliency. And there are 2 sides of this definition. One I like more than the other. The first one is makes more emphasis on the physical elements of resiliency. It's the capability of a strained body to recover its size and shape after deformation, caused especially by compressive stress. But I like the second one better because it includes the aspect of adjusting, not just recovering, but changing. And we all know it's very hard to go back. It's impossible to go back to where we were once we have been shaken by life, whatever circumstances, whatever physical condition, illness, adversity, or opportunity. It's only possible to adjust. Hi, good afternoon. So, and you're probably way familiar with this vignette. I use it a lot with the families of children with autism with whom I work. And I tell them, before you take care of others, take care of yourself. But I was so humbled by what a parent of a child with autism told me only last week, and precisely related to this talk. She said, I know that my child will be well if I am well, but I know as well that I will be well if my child is well. Wasn't she right? And I was like, oh my goodness, you're just giving my talk. This is what I wanted to talk about. Yes, we all know it's a necessity to breathe, to put the oxygen mask on ourselves before we attempt to help any others. But not so much conversation is about how helping others is so essential for our own emotional regulation. If we don't do that, you think that if the adult that is in that vignette wouldn't help the child. She would be, oh, okay, I'm still alive, I'm well. No, she would be destroyed. So this is my point. Emotional self-regulation and social regulation affect each other. They are two pieces of the same coin, two sides of the same coin. In other words, well-being, yes, is only my responsibility. This is my physical limit in which I actually have a say and a choice in my reality. I need to take care of myself. However, my well-being is connected to others' well-being and theirs to mine. So it is in the best interest of others that I take care of myself. That much is true, but also it is my best interest that I take care of others. And all of us who do the work that we do don't need to any convincing about this. We do what we do because it's fulfilling for us, because we wouldn't be able to think it any other way. This is our well-being at stake as well, in helping others, in accompanying others. I want to say something else about resiliency and well-being, and I want to quote Martin Luther King, an Atlanta native. You know, I live in Atlanta. I've been living there for 18 years. And he said, talking about peace, peace is not merely a distant goal that we seek, but a means by which we arrive at that goal. So I'm going to say that well-being and resiliency is also a skill rather than a state, a behavior, a process more similar to riding a bike or playing an instrument than to the distant goal that we seek. This is very important if we want to have systematic training in well-being. It's not a place where we are going to be when we recover from our condition, or when we learn to talk if we have a delay, or when my child no longer has autism, because that's not going to happen. It's a process. It's right here, right now, we start to practice resilience, and we start to practice well-being from right here, right now, as you hear me. We start this process, and we decide whether we want to participate in this process or we don't. And true, there are some objectives that are necessary, but it's in what we do at each time, right here, right now, which counts. And that is going to lead me to mindfulness. So, is there training to make us resilient? And I think we are much better at knowing what to do. We should take care of our physical health. We should take care of our diet. We should balance work and pleasure. But how on earth do we do that? This is the know-how, in my opinion, the most important part of this method that I would like to talk about today. And since we are engaging in wishful thinking, why not also a method that is universal, good for all of us from different countries, races, religions, but also personal. So something scientific with the guarantees that is applicable to all of us, but at the same time, we can turn into our own personal reality, in our own circumstances. And then why not wishing that it's also affordable instead of just going to a psychologist, and I'm a psychologist. I would love not to have, clients, but really, who can afford a psychologist? And then, of course, empirically validated with the guarantees that it works. So this is where such a method should focus on awareness, on attention, on that space between what happens to us and what we can do with what happens to us. This is the only space where we have a say in what we can do. We often cannot choose. Most of the times we cannot choose what happens to us. Actually, that's in The Lord of the Rings, Gandalf telling Frodo, "Dear Frodo, my friend, we don't choose what happens to us, but we choose what we do with what happens to us." It's all over the place. This is the space where we can detect, pay attention to our range of choices. Often they don't seem like many, but we still have a range between what the stimulus and the response that we give, and to choose that response we are going to give. In that space, Viktor Frankl, Holocaust survivor and neurologist, said, in that space is our power to choose our response, and in our response lies our growth and our freedom, the response to choose well-being and resiliency at each time. And beyond that, I would like to complement that quote with that other one from Shantideva. He was a philosopher in the 8th century who said, well, let's be realistic about our range of choices when we give a response. And let's see from within what it is that we can really do. I would love to change the weather. That would be magnificent, right? And have a sunny day every day, or make the world a better place according to my own terms. Is that realistic? I don't think it's realistic to cover the whole surface of the air with leather. But it is realistic to actually put leather just on the soles of my shoes. So this is what we can do. And that is the same as having covered the entire Earth's surface. And of course, metaphors are often too simplistic, but it gives us the idea of where we have to start, where we can find that realistic range of responses, where we have our freedom and our growth, not in changing others, although, trust me, I would love to be able to change others very often. It's in how I react, or rather respond to what others do. So, how does compassion come in all this training in attention? Because compassion is really the strategy to get what we want, taking into account our environment, which is mostly others. And let me go to the definition and try to convince you again that self-regulation and social regulations are part of the same thing. Compassion is actually the sympathetic consciousness of one's and others' distress together with a desire to alleviate it. This is our intention in life. We don't want to suffer. So anything that we do in order to reduce that discomfort, that suffering for ourselves and also for others is called compassion. I want to say this is the meaning of life. We want to be happy. We don't want to suffer. Love and compassion are as well two sides of the same coin. When you love others, when you love yourself, you want them to be happy. You want yourself to be happy. When you feel compassion for yourself or for others, you don't want them to suffer. You don't want yourself to suffer. So if you don't want somebody to suffer, you want them to be happy. So it's the same. I want to say with the utmost respect, love is the answer. And I'm a scientist. I'm going to provide scientific data for this. We're going to call it compassion. But it's love. So I want to say that love and compassion, if we train our awareness, that space, into practicing love and compassion, this is a training in emotional self-regulation and social regulation, which are the two pieces, the two keys in our well-being, in our resiliency, in our ability to face adversity, to adapt to whatever and anything, to life. All right? It's about social skills when interacting with yourself and with others. The piece on social regulation, well, we needed to prove that. There's evidence suggesting that actually being compassionate is good for others. It's not a surprise, right? But there still have to be scientific evidence showing that. If you practice compassion, others benefit from that. I will not spend too much time describing that. It's obvious, right? But this is the emotional self-regulation. It's also helpful for you. The more compassion you practice, the better your social support. So you will not be alone. It will protect you from disease and even death. We've known this all along. Now, I know you're thinking, I guess you're thinking this already, and I'm going to go there. It's not about giving yourself away so you're depleted and then you no longer self-regulate. It's about the balance. You know, how much I support you while keeping the oxygen mask for myself. This is going to be the key. But let me insist on the fact that compassion is good for self. Actually, there's psychophysiological evidence suggesting that social support is most beneficial in turn for individuals high in compassion who are best able to take advantage of it. That means that if you are high in compassion, your inflammation is lower, your cortisol level in blood is lower, your cortisol surge when you react to things is lower. That has been proved. And you can understand this very easily. Let's say I'm going to leave the room right now. Somebody in front of me slams the door in my nose. What would be my reaction, my automatic reaction that I have overlearned over the years? Let me be honest. And I would be thinking, how rude. How rude. Or maybe in my best moment, I would say, how careless, how absent-minded, which is a little bit kinder, right? With practice, this is how I can replace, even after the fact, my response, and freeze the space between stimulus and response and say, what are my options? What are the thoughts that I can have? And this is my ability to respond. Yes, I can think that person is rude. That's a possibility. I can think that person is absent-minded or careless. That's another possibility. Or could I think, given what I know, and I don't know much, that that person is in distress, that that person has something very urgent to attend to that makes him or her really worried. How do I feel differently about that? This is what compassion does to myself, regardless of the other person. So this is our ability to operate in our own environment, okay? And actually, social psychologists talked about this for decades. The do good, feel good phenomenon is actually something that shows that when you engage in prosocial behavior, you feel better as a result. It's not that people who are optimistic and happy engage in prosocial behavior, which is also the case, but it's been as well empirically supported. If you engage in a prosocial action, as a result, you feel better. So compassion is good for others and good for self. The Dalai Lama very eloquently describes why compassion is good for self. Well, it makes a lot of sense. When you think of others, you are not self-focused. You don't have such a narrow focus. You're distracted from your own problems. As I think of that person being in distress, I forget that, yeah, it was very uncomfortable to have the door in my nose, but I think of something else. So that's diversion. Then comparison. Because we always find people that have it worse than we do. And this is not to make us feel bad. Oh, no, it's actually to help us count our blessings. Thank goodness we are not our patients. We can help them. Okay? Then positive thinking. Human beings are problem solvers. We love to address things and to resolve. We don't like to be stuck in circumstances. We need to move forward. What it is that we can do. This is our essential nature. It's much easier to do with others because you're not so emotionally engaged, right? You see things from the outside, and this is the advantage that gives you mindfulness. If you know what I'm talking about, you disengage a little bit from your own situation and you problem solve. This is compassion, very different from empathy. I'm going to talk about that in a second. But empathy is feeling with others. Compassion goes a step beyond into problem solving, what it is that I can do. And let me tell you, ladies and gentlemen, we can always do something, absolutely, 100%. And if you think we cannot, I challenge that thought. Because even if it's listening, even if it's accompanying, even if it's doing nothing, because we think that anything that we could do would interfere, then we are helping. What is the most important ethical principle in all our professions for speech pathologists, psychologists, social workers, doctors, nurses? No harm. And we can choose to do no harm. So we can always do something. And this is as well our way out of the anxiety and the suffering that we feel when we feel with others, because we have empathy. So the Dalai Lama says, if therefore we seek happiness for others, we should practice compassion. And if we seek, if we seek happiness for ourselves, we should also practice compassion. Now, let me tell you as well, it's not that hard. It takes a little bit of an intention, a conscious effort, but not as hard because it's already an innate biological attribute. And I want to make a case about that. And I know competition has a lot of publicity, and it has had a lot of publicity over the years. But cooperation is as well part of our human history. From the beginning, we cannot help but cooperate, and we cannot help but feeling for somebody who falls in front of us and is a stranger. We cannot help but feeling for a puppy, most of us at least. We cannot help but feeling with a beautiful sunset. That's in us. It's very innate. So I want to quote Franz de Waal, who is a primatologist who worked at Yerkes, at Emory University. And I have a history working with chimpanzees as well, so I know what I'm talking about. He said, don't believe anyone who says that since nature is based on a struggle for life, we need to live like this as well. Many animals survive not by eliminating each other or keeping everything for themselves, but by cooperating and sharing. So competition is part of our human nature, so is cooperation. This applies most definitely to pack hunters, such as wolves, but also to our closest relatives, the primates. And he quotes Hobbes, the British philosopher. He said, man is wolf to man. True, he says, in so every sense, not just the negative one. We would not be there where we are today had our ancestors been socially aloof, had our ancestors not cooperated. So compassion is there. Now the key, the Dalai Lama says again, is to expand it using our intelligence and our conviction. Okay, it doesn't come without an effort, but the alternative is much harder. The alternative is struggling, not adjusting, not seeking our well-being, not using our best allies, which are others, and also see them as an obstacle that we need to overcome. This is what compassion does for us. So, I'm going to talk about exactly the method and techniques that allows us to expand this innate capacity for warm-heartedness and using our intelligence and conviction expanded. We all feel at a biological level this compassion, like the mother's love for her baby. Most of the times, we also feel the stress with our baby. But it's precisely biased and limited in scope. And this is not, and I'm saying, struggles and difficulties also come from others. It's not about loving their actions when we think they are mistaken. It's about understanding where they come from. Our love is for them, not for their actions. So the more that we understand them and love them, even without liking them, the better we'll be able to address their actions that need to be addressed and to correct them. I'll go there in a moment. So I already said compassion and love are two sides of the same coin. It all starts in empathy. Empathy is necessary but not sufficient for compassion. People talk nowadays about compassion fatigue. It's not really compassion fatigue. It's empathy fatigue. You feel the problems of the world, and of course you sink. You don't sink if you think of a way out. That is compassion, if you problem solve. So we need to feel in order to have this unbearable feeling that we need to do something about it. But we should not stay in that unbearable feeling if we don't want to feel depleted. Because if we feel everything and we don't think of a way out, what's the point? Okay, so we need compassion. But in order to feel compassion, I'm sorry to say, we need to feel. And all of us who do this job know it is helpful to feel. Actually, in the medical profession, there was this myth, but fortunately things are changing about There was this myth about not feeling too much and being able to do better our job if we don't feel too much. I'm sorry to defer. I beg to defer. Actually, the suicide rate in medical providers and physicians is the highest. And I think the lack of empathy, actually trained culturally, is part of that reason. You need to feel, but you need to know what to do with your feelings. If you don't know what to do, you are as lost as if you don't feel. So, to feel empathy, psychologists talk about two portals for empathy, to feel with others. That's identification and that's reciprocity. It's much easier to feel with people with whom you identify. The recent tragedy in Indonesia, I don't know how it may ring to you, but they are very far. It's hard to think that, those people in a different country, maybe from a different religion, different culture, are that similar to us. But when you stop and think, and this is precisely the conscious effort that you can make, that it takes only a tiny little effort, when you realize they are more similar than different, they all had a broken heart in their lives. They lost somebody, they are very confused, they are very scared, they have lost everything. When you find that similarity, that is actually that something that you share, you start to feel much more for them. And that's the reason why we feel so much more if this happened closer to us or to people that we know. This is similarity that happens in a very innate way, but we can work and activate to feel empathy, to do something about it. If we feel for those people in Indonesia and we acknowledge that we are more similar than different, and they are as lost as we have felt, or even more, we will want to do something. The second part is reciprocity. Reciprocity is the give and take that we all engage as human beings. We receive from our parents or from the community that raised us, and we give back, and that establishes a connection. Well, this is as well something that is not given so naturally with people that are in different parts of the world, or we haven't interacted with, or they are from different races or religion. But it is very true as well that we are connected with them. And it's becoming clearer and clearer at this time and age of internet, when we realize we are all interconnected. What happens in China affects the US. What happens in Puerto Rico affects us here. What happens in Indonesia affects us here. What happens here affects them. We are really interconnected. So when you take that extra step, you start to feel the reciprocity. And when you realize that what we have in common is more than what separates us, you feel the identification, feel for others, and then you take a step farther into compassion. What do I do with this unbearable feeling that others are suffering? But this is where you have to be very realistic about your own means and know, well, this is how much I can do. And I have to respect that for my own sake and others' sake, okay? Before you start with identification and reciprocity, you need to know your value as a human being. What you want, what you can change, what you cannot change. This is precisely what I'm talking about. You need to know your means. You need to be humble, but honest, but kind. And you need to love yourself. And when you love yourself, or at least you need to engage into that training. Remember, it's not a distant goal. It's how you practice, and you get better at it each time. And I have to say the journey never ends, in my opinion. But it's very important to have a value of yourself and to know very realistically and kindly what you are, what you can do, in order to look at others as similar and equally worth it, and then you see others as connected with you, and then you feel for others and you do something about it. So this is the mindfulness and compassion training that I want to talk about. It was designed, developed by Dr. Negi, a former monk. Actually, he was a student of the Dalai Lama himself, and my teacher. and he's the director of the Center for Contemplative Science and Compassion-Based Ethics at Emory University. And he took this Tibetan Buddhist tradition called Lojong, mind training, and combined it with insights from contemporary emotion science and neuroscience, and created this cognitively based compassion training. And yes, it is secular, it is universal, so it is compatible with any faith or no faith tradition. But I want to add, it can be turned into something very personal. And it's also very affordable. So let me tell you what we do through the modules, sequential modules of this training. It's not, there has to be other ways to do this. I'm just presenting a way, okay? But I think the key points is working on awareness and bringing compassion into the picture. And we do that through a little bit of lectures, like this one, in which people get to a certain level of understanding. I hope that by now you agree with some of the things I've said. That gives you a little bit of learning, but you know it's not enough. The next level, when you have your aha moment, is when you really internalize something that I'm saying and relate it to your own experience and feel it in your body. That's why we talk about embodying this knowledge, this information, this experience. If this little story about the door resonated with you and reminded you of some other personal event that you had in which you perhaps could have done something differently, then you are having already an aha moment right here, right now. If something is making you feel goosebumps, because it can be as subtle as that, you don't even know why. But this is when your body gets the message that at the first level, all intellectually, you're understanding. You want to go to the second level. You want to have those aha moments. And then you want to go back to that. Repeat it by association and repeat it. Psychologists know that we learn by association, by repetition, and this is what creates a solid neural circuit that will be long-term potentiation is repeating a circuit. So you have that aha moment, you feel it once, you feel it again, and you feel it again, and generally on the cushion because it's a safe place, or on a chair, or in a quiet place, because you can engage into this reflection and find that feeling over and over again. And this is as well another meaning of meditation. It's not only mind training, it's also cultivation, familiarization. It's the repetition. So CBCT takes these lectures, these expositions, but it takes, much more importantly, personal effort of each of the participants that we can do in a group or then later personally. And the more you repeat, the more successful you will be. And these repetitions that you have in your mind will actually have an effect on your life. I'm going to go over the 6 modules of CBCT now, and then I will show you a video, which will be a case study of a professional feeling burnout that actually did CBCT, and I'm going to suggest you, James, to stop the video now because otherwise we are going to run out of